Welcome back, everybody. Today, as you know, was day two of Ben Bernanke, the Fed chairman, up on the Hill, discussing challenges for the U.S. economy. Talked about a variety of subjects, including health care. Well, Jay Timmons, Senior Vice President of Policy at the National Association of Manufacturers, recently sent a letter to the House of Representatives opposing the health care reform bill. Jay joins us right now with his thoughts from Washington. Jay, good afternoon.
Good afternoon.
Talk to me about that letter. What specifically did you guys say? What upsets you and concerns you?
Well, you know, healthcare clearly is a pretty big issue that all Americans are grappling with. Manufacturers are not unique. We have some concerns with the bill, the healthcare reform bill that is currently percolating in the House of Representatives. And one of the big issues that we're addressing that was in that letter is how the plan would be paid for. Instead of being paid for within the current system, there's a proposal to basically tax small businesses, and that would harm job creation in the United States.
All right, that makes sense, but give me some more specifics. So tell me how hard of a hit in terms of this surcharge, what it would mean to some of your members. Can you give me some numbers?
Yeah, I can tell you that the tax surcharge that is being contemplated on the Hill would have a fairly dramatic impact on members. The first proposal, or the proposal that was first being discussed, was to tax, quote-unquote, the wealthy over $350,000. And what folks really don't understand a lot of times, and it seems like some on the Hill don't understand, is that small businesses often file as individuals. And the tax that is being proposed is on income that is not take-home pay, but it's funds that aren't spent that could be used for reinvestment in job creation or research and development or expansion of the facilities. So it could be a pretty huge hit.
All right. So what do we do instead? Do you guys have any ideas in terms of a different proposal?
I think what we really are going to have to do is look at maybe a different way of moving forward. We're still hopeful that the Senate bill, the Senate finance package, will have a bill that makes a lot more sense. But right now, the House bill, as it's currently drafted, is too expensive. It, in some cases, doesn't allow individuals who want to keep their current plan to keep those plans after a certain period of time. The surtax we've already talked about. And quite frankly, if we're going to have effective health care reform, everything has to be on the table and not just tax increases. Things like pooling insurance policies for small businesses and individuals and the self-employed, and also taking a look at how we can end frivolous lawsuits that are costing Americans over $100 billion a year.
All right, I'm curious, you know, you've obviously, sent this letter to congressmen. What's been their responses in terms of addressing your members' needs?
Well, you know, we've been very pleased with the response we've gotten from several members of Congress. One in particular, a freshman Democrat from Colorado, Congressman Jared Polis, is a former small business person himself before he came to Congress this year. And he wrote a letter to the Speaker echoing our concerns that this surtax on individuals would have an adverse impact on small businesses and cost jobs. And he had several members of the Democratic caucus that signed onto that bill as well.
Jay, safe to say, though, everybody's going to have to potentially share in the expenses here, and that means there will be some impact, not only, you know, on all kinds of businesses, but your members as well.
I think what's happening is everything is not on the table. It was, at one point, the discussion point was, hey, everything's going to be on the table. We're going to look at this very comprehensively. And only a few things have survived. And unfortunately, it's the expensive fixes and the tax increases that survived. Things like curtailing lawsuit abuse, pooling insurance, and actually making every individual have some self-responsibility for insuring themselves. That seems to be off the table as well. And we can do that through a variety of means. But for those who can't afford health care coverage, we ought to be looking at a tax credit for those individuals.
All right, Jay, we're going to leave it on that note. Listen, thanks for your time today. Jay Timmons at the National Association of Manufacturers.